Well, kia ora koutou katoa. Welcome to the Ministry of Health, and thank you for including our sign language interpreter in your picture. So, as you may be aware, the second case of COVID-19 is confirmed in a New Zealand citizen. This is a woman in her 30s, recently returned to Auckland from northern Italy. The results of the test were formally notified to the ministry at about 6 o'clock last evening. At that point, health authorities began with, of course, notifying the woman and her family and initiating a range of processes, in particular contact tracing. So although we have our second case of COVID-19, what I can say is with continued vigilance, the chance of widespread community outbreak is expected to remain low. So the woman confirmed with COVID-19 is in self-isolation in her home with appropriate clinical support from public health and district health board staff. Self-isolation at home is well recognised by the World Health Organization as an appropriate response for people with mild to moderate symptoms. She does not require hospital level care. The woman's immediate household contacts are with her in self-isolation as a precautionary measure. I should say that the woman's partner has also displayed symptoms and is being tested. Public health officials last night began tracing the woman's other close and casual contacts to ensure appropriate protection measures are in place. Now, the flight on which the woman returned to New Zealand was from Singapore to Auckland. This was an Air New Zealand flight on the 25th of February. It was flight NZ0283, Singapore to Auckland. So in addition to proactive contact tracing of close contacts on this flight by public health staff, contact will also be made with everyone on the flight to ensure they have relevant information. And a reminder, close contacts on a flight are the people who were in the same row as the case, 2 rows in front and 2 rows behind. Anyone who was on this flight and is concerned or would like information should contact the helpline number 0800 358 5453. The woman who has now tested positive for coronavirus also took 2 domestic flights. On the 2nd of March, Air New Zealand flight NZ5013 Auckland to Palmerston North, and on the same day, the 2nd of March, NZ8114 Palmerston North to Auckland. So in addition to proactive tracing of close contacts on that flight or those 2 flights by public health staff, contact will also be made for everyone on the flight to provide relevant information. And we are working very closely with Air New Zealand to get in touch with the people who were on those 2 flights, as well as the international flight, which, as I said, was also an Air New Zealand flight. Once again, a reminder for all of those flights, close contacts are people who were in the same row as the case and the 2 rows in front and 2 behind. Anyone concerned who was on the 2 domestic flights is welcome to also get in touch with Healthline 0800 358 5453. Contact is also being made with the 2 medical centres where the woman sought advice and treatment to determine if there is any risk to staff or other people who may have been at the centre at that time. This is a standard part of contact tracing, and appropriate contact tracing and action will be taken as required by the Public Health Unit. 2 schools have also been notified about the positive test, as there is a family member at each of those schools. After careful consideration and in discussion with the family and the schools, we are telling you that those schools are Westlake Boys and Westlake Girls High Schools. The family members, and this is very important, please, the family members who attend these schools are not symptomatic and are now at home in isolation. They did not travel to Italy. They are both well, and they are both being monitored. The Ministries of Education and Health will work together to provide the schools with appropriate advice and support. The ministries also want to emphasise, and I will as well, that contacts are not at risk, recalling neither of these two family members are symptomatic. And I do want to quote from the comments in the speech from the Director General of the World Health Organization overnight, in which he compared COVID-19 with influenza. And this is very important. Both COVID-19 and influenza cause respiratory disease and spread in the same way via small droplets of fluid from the nose and the mouth of someone who is sick. However, there are some important differences between the two. First, COVID-19 does not transmit as efficiently as influenza from the data we have so far. With influenza, people who are infected but not yet sick are major drivers of transmission, which does not appear to be the case for COVID-19. And that's very pertinent to this particular situation. Evidence from China is that only 1% of reported cases do not have symptoms, and most of those cases develop symptoms within 2 days. Just to reiterate, contacts are not at risk. In closing, I want to say that this is a Kiwi family that has been affected by a virus that is part of a worldwide outbreak. What they need is support and understanding, and our task is to ensure they have all the support and healthcare they need. And just a reminder to anybody who has travelled to China, Iran, Northern Italy, and South Korea in the last 14 days, they should be in self-isolation and registered with Healthline. Thank you very much, and I'm open to questions.
Dr. Bloomfield, how worried are you that this woman travelled so far and wide in New Zealand carrying this?
I am interested in identifying all the close and casual contacts and ensuring that we put in place the public health measures. What I should say is that the immediate circle of family and close friends who have been followed up with public health and are now in self-isolation is small. The woman has not been feeling well. Yes, she travelled to Palmerston North and back, and that is the focus of our efforts at contact tracing on those flights. However, this is exactly the sort of contact tracing we would expect to do and are geared up to do and is well underway now.
What can you tell us about her day-to-day movements, like supermarkets, dairies? Are you tracing that back? What can you tell us about that?
I don't have detail. What I can say is that she has been feeling unwell and has been largely at home because she has been feeling unwell.
So just to clarify, is the Ministry of Health not aware where else this woman has been other than those domestic flights and those 2 visits, I believe it was, to medical centres? You don't know if she went shopping or visited anywhere else?
The Public Health Unit was in contact from early on last evening and has been in contact a number of times since, and they have a detailed understanding of the movements of the case, and they will be assessing the risk of and ensuring that any potential for close or casual contacts is appropriately traced. I don't have that detail, but the people who are doing that work, Auckland Regional Public Health Service, do have that detail.
Was this woman unwell prior to coming to New Zealand, or showed any symptoms at all on that flight from Italy, which ended up in New Zealand?
She developed symptoms once she had arrived in New Zealand.
Okay, so she had no apparent symptoms when she arrived at Auckland Airport?
Correct.
Had her partner travelled to Italy as well?
Yes, her partner had been with her in Italy as well.
You said you're interested in her movements, but are you worried, though, as the Director General of Health, about her movements? Are you worried about those movements?
I'm not worried. What I am concerned is that we get on and do the appropriate contact tracing and put in place the appropriate public health measures.
In terms of the schools, anyone else being isolated or being monitored between teachers, friends, other pupils at all of those two schools?
No, just to reiterate, the children who attend each of those schools are not symptomatic, and they are now in self-isolation at home.
Given the first person-to-person contraction in Australia, are you saying that that's not possible with these kids to get from your mother, or?
Yes, it is possible. And in fact, interestingly, some of you may have seen the report that WHO did on the joint mission, the 9-day joint mission that WHO did to China between the 16th and 24th of February. And there's a couple of interesting bits of, well, there's a lot of interesting information in it. I commend it to you. One of the important points in that is In China, human-to-human transmission of COVID-19 virus is largely occurring in families. Hence, of course, our isolation of the families. However, another very relevant point here is that data on individuals 18 years and under suggest there is a relatively low attack rate in this age group, 2.4% of all reported cases. Now, I realise it's quite a few numbers to get, but also even in those families where there is transmission, it's less than 10% of family members who then become symptomatic or get the virus, and that was found through this exhaustive look at the data from China, which, as we know, has had the outbreak the longest and has the largest number of cases.
And have you been tracking your partner's movements as well? She said that he's not feeling well either.
Yes, that's right. That will be absolutely part of the contact tracing. And what I can say is there's this very, very strong overlap of the contacts for both the person and their partner.
Just in terms of tracing, how detailed are you going to the tracing? Is it day-to-day where they went?
Correct.
On Monday they went to the supermarket, then they went to the park sort of thing. How detailed is it?
Very detailed. So the Auckland Regional Public Health Service gets a day-by-day, movement-by-movement description, and then does an assessment of, in particular, whether there is any potential for close contact. And I've talked about the settings that we are actively following up in the first instance, or the public health unit is the flights, of course, as well as the medical centres that were visited.
Do you know that it's been in like a big conference sort of thing, like for example, Palmerston North, was it for a conference sort of thing, or any areas we have been?
No, it wasn't. And as I say, the person's been feeling unwell, and so they haven't been doing much outdoor activity or outside the house.
What was the testing regime? How many tests did it take to get to this positive result?
So the positive result was on a swab that was taken by a general practitioner on Monday, and we got the result late yesterday, Tuesday.
The first test.
That's correct.
Was any consideration given to closing the schools?
No, that's not necessary. And as I say, just to reiterate, the students, one in each school, are not symptomatic. And as I've outlined, there's very clear data from China that people who don't have symptoms are not ones who spread. So that spread the virus. The virus is spread through droplet spread by coughing and sneezing.
What part of the plane was this woman sitting on that international flight?
Yep. I don't have the details about the row numbers, but Air New Zealand, who is working closely with Healthline, does. And so if anyone calls Healthline, they will be able to be told whether or not they are potentially a close contact or a casual contact.
And when does the husband get his results back?
We're expecting those results later today, and we know there's a high level of interest, so we will of course report that result, whether it's positive or negative.
Do you have a general idea of how many people may have come into close contact with the woman?
Do I have a general idea? It's a relatively small number of family and friend close contacts, and on the planes, I don't know what the aircraft is that comes back from Singapore to Auckland, but if it's a Boeing 777, it's something around between 30 and 40 people if all the seats are occupied.
Given it's like the 25th of February since you've returned from Italy and she's travelled to Palmerston North since then, I mean, it could be hundreds of people. You don't have any sort of idea of how many that might be.
So just to reiterate, close contact is within a metre for more than 15 minutes. So, and as I pointed out, the data from China are really quite helpful here because they show that most transmission is occurring in families. In other words, people who are in close contact with each other for periods of time, quite long periods of time.
There's a feeling in the community that we're overblowing this outbreak. Are we?
I don't think so at all. I think we've been very alert and very responsive and flexible in our response right from the start. There are no prizes for underdoing our response here, and you can see that other countries around the world are also ramping up very significant responses to this threat.
Could you just give us a quick recap? How many cases we've got and how many suspected cases that we might have?
So we have the two cases confirmed, the one last Friday and the one I've just announced today. There is testing underway at all times on a number of samples. So there have been over 160 samples tested. I don't know exactly how many are underway just at the moment. Testing is ongoing. The other thing I'd like to point out is that we convened urgently our technical advisory group this morning by teleconference just to give us further advice on the case definition. So we're looking through the advice we've had from them, and we'll be able to inform ministers this afternoon when we meet with them.
If we've had human-to-human transmission here, how long would it take to get to its peak, its worst stage?
Look, I couldn't comment, but we can look at different countries and see both what happened in countries like China as well as other countries with big outbreaks. But most pertinent, of course, is to look at countries like Australia, where they have had sporadic cases, and the fact that routine and good public health measures have contained any further onward spread. And that's exactly what we're doing in this case.
Can you tell us what measures the airports are taking that comes to North and Auckland?
So the airports themselves won't need to take any additional measures because, as you would recognise, people will move through the airports fairly quickly. Again, the key issue here is about ensuring that close contacts or potential close contacts are traced and followed up. And you'll also be aware that airports have and aircraft have very regular and rigid cleaning regimes.
So we basically, given that definition of close contact, we're fairly confident then that people outside of those plane rows and who close family and friend circle, outside of that, the chances of having infected someone really are reasonably low.
Very, very low. However, they are what we call casual contacts. So it's not zero, and then therefore it's important those people are aware of the situation and are able to respond very quickly if they do develop symptoms and call Healthline. And that's the purpose of contacting those people.
What circle of people is quite...
The circle of people in terms of immediate family and friends that the case has been in contact with since coming back to New Zealand is small.
What's the plan for government staff in terms of coming to work if we do get to an outbreak scenario?
Oh, well, we're a long way off that. However, if you look at our New Zealand pandemic plan, and I know there's been quite a lot of interest in this because both the UK and Australia have talked about, or there's been talk about rather, expansive measures. These are all detailed as potential measures in our pandemic plan, and of course they are informed by what is happening at that point in time. It may be that first of all you would have staff who are unwell and away from work anyway, but one of the measures that government agencies can take is have staff work from home, and that's one of the things that everyone is looking at, every government agency, as part of their business continuity planning right at this point in time.
Is that the only option that we have, or are there other options other than working from home?
For government staff or for... of course, it depends what happens with the outbreak. It may well be that people may need to stay home. For example, one of the actions that's possible, and we've seen this happen in Japan, is that you could close schools. Now, if that happens, people generally would need to stay home to look after their children. So one has to be adaptable and flexible and consider all the options as the situation unfolds. Fortunately, we are still early on. We are keep it out, stamp it out, and our actions with respect to this case today are very much focused on that. One more question, please.
Do you have any response to the reports about people who are unwell and requesting tests and not being tested because they don't fit that strict criteria of those symptoms?
So
if we're taking a precautionary approach, shouldn't we simply test it?
So two comments to make there. First of all, we've done over 160 tests and over 2 are positive. Only 2 are positive. So it seems to me that that's about right. We should be testing more than are positive. It means we are testing people who may not quite fit the case definition, but there's enough suspicion. And secondly, at the media stand-up yesterday, we talked about the fact that whilst we are guided by the case definition, and contrary to some commentary, it is not rigid. It is also applied with the clinical judgment of the clinician and in discussion with an infectious diseases specialist to make sure that the right people are being tested. If there's any doubt, and we saw this with the first case where there was a high level of clinical suspicion, if there's any doubt, the clinicians will test. There was a question at the back, and that's the last one, please.
We've heard that she might be in-home childcare worker and she possibly had contact with children. Is there any truth in that?
I've given you all the information that is pertinent, and I've said several times that this person has had a small group of family and friend contacts, and I stand by that comment. Thank you very much, and we'll keep you well informed about what's happening with this case and other matters. Thank you. Thanks, Alan.